Hello?
Hello, good evening.
Hi, good evening. Can you hear me?
Yes, I can hear you. Can you hear me?
Yes. There's a lot of noise in the background.
There is some noise in the background.
Your background, yes.
Okay, all right. Our technicians will work on it. Are you able to see me physically?
I can't see you. I can only see myself.
Oh, okay, all right. Now, if you can see yourself, then well and good. Still fine.
Okay, now I can see you.
Okay, all right.
We are on standby.
Okay.
Where's your phone?
My phone.
London. So there's that number. You know the number?
No.
And your phone is
No, I have. Anyway, those are internal issues too. verbal contracts.
0764
0764 25
00
00
55.
55. I just knew it was similar to my number, so.
Okay, standby.
Okay. So just stand by, Miss Mange. Is it Mange? Mange? Mange?
Mange.
Mange. All right.
Mange, yes.
All right. Hey, what? What's starting now?
This message has been powered by the Center for Trade Policy and Development, CTPD, with support from the Open Society Initiative in Southern Africa, OSISA, OSISA.
From the north to the south, from the east to the west, Shonse Femi Dundu, once if you have in Zambia, this time we stood together, one Zambia, one nation, pamoktua chifyo ulwele wa coronavirus.
Tigwirizane tinkane panja imozi, I corona sinapwele kuchita vingazi. I corona ilibendiwe fama, I corona ilibe I corona ilibendine leader, anza kontrolola no. Corona ilibendine teacher, corona ilibendine doctor, corona ilibendine police, anza kontrolola.
Tisebenze pamozi ya mai, matenda tinga silize. Tisebenze pamozi ya bambo, pamozi tinga kwanise. Tisebenze pamozi ya mai, matenda tinga silize. Tisebenze pamozi ya bambo, pamozi tinga kwanise. As we adapt to the new normal, together we can pull you in a solo. The farmers and the traders must sell like a bully.
TNT sambe kumanja osakwila kumenso, makamaka mwe balimi mwali ba essential.
Mulyesha ziko, mumeole meke zeko.
Mukalale plasi konsefe na kumishi, amafunde bale sosa tuyasungishe.
Tigwirizane tinkane panja imozi, I corona sinapwele kuchita vingazi. I corona ilibendiwe fama, I corona ilibe I corona ilibendine leader, anza kontrolola no. Corona ilibendine teacher, corona ilibendine doctor, corona ilibendine police, anza kontrolola.
Tisebenze pamozi ya mai, matenda tinga silize. Tisebenze pamozi ya bambo, pamozi tinga kwanise. Tisebenze pamozi ya mai, matenda tinga silize.
A wonderful good evening. It is the 9th of July 2021. Welcome to Unscripted. My name is Chisha Chola and I'll be your moderator for this particular evening's Unscripted. Now, of course, in the world of COVID-19, in the new normal, with so many people lining up to get their vaccines in various parts of Zambia, we've seen that COVID-19 has been an issue and is affecting the health of many Zambians out there in society. But of course, where does the issue of the National Health Insurance Scheme come in? This is what we discussed this particular evening on Unscripted with, of course, the Center for Trade Policy and Development. And we do have Miss Chileshe Jimange coming from CTPD. Good evening. Good evening. Are you able to hear me? Miss Chileshe Jimange, are you able to hear me? Hello, Miss Mange. Hello, Miss Mange, are you able to hear me? Hello? All right, even as our technicians are trying to get hold of her, we are discussing the National Health Insurance Scheme in this COVID era. That is our topic for tonight's Unscripted with CTPD. Of course, be able to join the conversation later on after we open the phone lines, and of course after we discuss a few things here and there. And of course, you'll be able to call us on the number that is showing on the screens, but that is 0764250055, 0764250055. That's the number that you'll be able to call us on later on after we open the phone lines. But of course, before that, we'll be able to engage into a discussion on the issue of the National Health Insurance Scheme and in the era of COVID-19. So be able to just look out for that. And even as we discuss the topic at hand on Unscripted, we do have a member from CTPD, Miss Chileshe Jimange, who is going to join us pretty soon, even as we are breaking down and cultivating on the topic at hand. And the issue of the universal health coverage, of course, did come through because of SDG number 3 of having good health and well-being. And of course, that is the universal agenda of trying to put through with the health coverage of every particular citizen and every particular person who is adding to the close to 8 billion population of the world. All right, the agenda of each and every particular country who signed towards the SDGs is to ensure that there is good health and well-being in the whole world. And this is where the agenda is coming through with concerted efforts in trying to achieve that every particular person has good health and well-being. Is Miss Mange, are we able to have her now? All right. Indeed, let's go for a break. We'll be back.
This message has been powered by the Center for Trade Policy and Development, CTPD, with support from the Open Society Initiative in Southern Africa, OSISA, OSISA.
From the north to the south, from the east to the west, Shonse Femi Dundu, once if you have been a Zambia, it's time we stood together, one Zambia, one nation, pamoktua chimfyo ulwele wa coronavirus.
Tigwirizane tinkane panja imozi, i corona sinapwele kuchita vingazi, i corona ilibendiwe fama, i corona ilibe i corona ilibe ndine leader, anza kontrolo
tingasilize tisebenze pamozi ya bambo pamozi tingakwanise tisebenze pamozi ya mai matenda tingasilize tisebenze pamozi ya bambo pamozi tingakwanise. As we adapt to the new normal, together we can kulio and a solo. The farmers and the traders must sell it like
TNT sambe kumanja osagwila kumenso makamaka mwe balimi mwali ba essential
Mulyesha ziko Mwole mekezebo
mukalale plasi konsefe na kumishi amafunde bale sosa tuyasungishe
Tigwirizane tinkale panja imbozi I-corona sinapwele kuchita vingazi I-corona ilibendiwe fama I-corona ilibe I-corona ilibendine leader Anza kontolola no Corona ilibendine teacher Corona ilibendine doctor Corona ilibendine police Anza kontolola
Tisebenze pamozi ya mai matenda tingasilize tisebenze pamozi ya bambo pamozi tingakwanise tisebenze pamozi ya mai matenda tingasilize tisebenze pamozi ya bambo pamozi tingakwanise.
Lile mule afu abalimi mwe balabako kwa bulabena nefya kulyanga tafibako TNT konkanya kofya kula isunga na mafunde basosokula ya konka COVID-19 kutwa ichimfe tubike profeka hygiene
uko kufamu valani na mamaski kuzamba kumanja ndiye ngani alelelelelele uko kufamu valani na mamaski kuzamba kumanja ndiye ngani lelelelelele.
This message has been powered by the Center for Trade Policy and Development, CTPD, with support from the Open Society Initiative in Southern Africa, OSISA, OSISA.
from the north to the south, from the east to the west. Shonse Femi Dundu, once if you have in a Zambia, it's time we stood together. One Zambia, one nation. Pamok to achieve your coronavirus.
Tigwirizane tinkale panja imbozi.
Welcome back to Unscripted. Of course, we were, of course, trying to reconnect to our guest for this particular evening, who is Miss Chilesha G. Mange from Center for Trade and Policy Development as well. And we're discussing the role of the National Health Insurance Scheme in this COVID era. And of course, I'm pretty sure that the guest is back now. Miss Chilesha G. Mange, are you there?
Yes, I'm here. Good evening.
Okay, all right, great. Good to have you. And of course, I did introduce about on our topic earlier on. Let's get right into it. What is the National Health Insurance Scheme?
Okay. So, the National Health Insurance Scheme was established by an Act of Parliament, and it's been operational now since October 2019. So the objectives of the National Health Insurance Scheme is to provide universal access and health coverage to all Zambians. So in essence, the idea of the National Health Insurance Scheme is to ensure that every Zambian has access, firstly has access to healthcare, secondly has access to quality healthcare, meaning that they have access to very specific health services. And of course, another objective is to ensure that there is sound financing for the universal health coverage and the universal access. So as things stand, the National Health Insurance Scheme is managed by NEMA, which is the National Health Insurance Management Authority. And every citizen between ages 18 to 65 qualifies for this scheme, and is also then required to remit at least 2% of their total earnings. So if you're an employer, your employer will remit 1% of your basic salary, and then you as the employee will also remit 1%. and it's supposed to apply across the board to the both formal and the informal sector. It also is meant to cover both public and private healthcare services, healthcare providers, sorry, which means that if you are a member of the National Health Insurance Scheme, you can actually have your choice of where to go for healthcare services, be it the public sector or the private sector. Now, the thing is, as at the beginning of this year in January, NEMA had accredited only 130 healthcare providers, the majority of which were public healthcare providers, and then the other followed by then faith-based organizations. So, for instance, your mission hospitals, for example. So, what we don't have currently are a number of private healthcare providers participating in the National Health Insurance Scheme, which is a bit of a problem, especially as you consider the advent of COVID and the numbers that we have had recently with this period that we are experiencing. So, among the bottlenecks that we identified as CTPD include the fact that as things stand, there are still hospital fees applicable and fees for consultation applicable to a number of to members of the public who then seek healthcare, particularly in private hospitals. So a member of the National Health Insurance Scheme could still find themselves paying anything between 200 kwacha and say 80 kwacha, depending on what sort of hospital they go to and what services they are seeking. We also have a situation where, as things stand, the insurance scheme still is currently operating in parallel with other private insurance companies. And these, of course, the private insurance companies are profit-making. So what you have is a system of free national health care, which is what the NHIS is trying to achieve, and then you'll still have those that are providing paid-for services. So you find that in many instances, as an individual, you'll be remitting your 2% to the National Health Insurance Scheme, but still then be paying towards a private health insurance scheme because of the differences in the infrastructure that are available in your public hospitals as well as your private hospitals. So another problem that we've identified is a health management system. So what we have is a situation where the informal sector is meant to also be participating in the National Health Insurance Scheme, also rural communities. But what we've seen so far is that the registration is done primarily online. So what does this mean then for those in the informal sector, or rather those in the high-density, low-income areas or in the villages, rural areas, who don't have access to, say, internet and other digital services? How do they then access the National Health Insurance Scheme without being registered for it online? So we do also see that there's a need for a very effective healthcare management system. Another issue is limited access of coverage due to poor infrastructure. I think I've already touched on this one. So we have deficits in terms of our infrastructure for healthcare provision. Private hospitals naturally have more healthcare, more healthcare services and infrastructure as compared to rural areas. We also have a situation where there are inequalities that persist between those in the rural areas and those in the urban areas. So, for instance, at the lowest end of the spectrum, you find that people still have to find or have to walk or access healthcare facilities that are up to 100 kilometers away from where they live, according to WHO. And also, you also find that you have one doctor for every 12,000 Zambians in a lot of the rural areas, which is the lowest end of the spectrum. So we have to also address these disparities if we're going to talk about what the NHIS is doing, especially particularly in a COVID area. Another key issue, again, as I've mentioned, is the informal sector exclusion. So we know that that's basically a black hole. So to what extent are those in the informal sector actually remitting their contributions to the NHIS? By law, every citizen who is able-bodied should be remitting 2% to the NHIS of their earnings. But those in the informal sector, to what extent are they remitting those funds? Because what you have is a situation where it is actually those in the formal sector who are about 50% of the whole workforce in Zambia, who are the ones then required to remit, who are remitting faithfully and are then therefore subsidizing the rest of the masses. And also that's a challenge in terms of raising financing for the National Health Insurance Scheme. So as we look at all of these bottlenecks and all of these issues, we have to ask ourselves, so to what extent is NHIS actively involved in helping us to combat COVID? We know that in many instances, the COVID tests are not free unless it is done by a referral to a doctor. We know that there's been mass hospitalization. we know that there's been need for medication and x-rays and all kinds of diagnostics. So it's challenging in terms of, we know that many insurance companies, private insurance companies, are actually now reluctant to pay out COVID tests. And so this is the point where NHIS should be involved and covering this gap or building this bridge. So part of what we want to discuss here today is what exactly is the role that the NHIS is then playing given all these bottlenecks, and is it truly an effective system? Is it one which was perhaps implemented too soon? Do we have the capabilities as a country to implement a system such as this one, given how far back we are in terms of infrastructure and just generally economic conditions of the country?
All right. Now, of course, maybe you can also be able to elaborate a little bit more on what led to us in having this particular national health insurance enacted, of course, which was enacted in 2018 by President Edgar Lungu. But just what really led to the transition or fostering this particular scheme in 2018?
So this has been a long-term vision or plan of government of Zambia, and in principle, it's not a bad idea, not at all. The idea that every Zambian should have, number one, access to healthcare, and number two, access to specific healthcare services, is one that I think speaks tenet of what the government of Zambia, the current regime, has been trying to achieve, social equality and so forth. So it's not a bad idea, and it was always something that was on the table. I think all that we're seeing now is that it's one that it's taken some time to kick off, and like I'm saying, we're experiencing very specific bottlenecks in terms of how it's being implemented and how it is being rolled out.
All right, and what methods and approaches will the National Health Insurance Scheme use?
Sorry, please repeat that question.
Yeah, what methods and approach will the insurance scheme use?
Okay, so as things stand, firstly, there is a process of accrediting institutions. So which means that they go through a process of identifying healthcare providers that will participate in the National Health Insurance Scheme. When they participate, what they're required to do is to attend to or provide healthcare services to the public for free, and then receive their subsidies or receive the subsidies, yes, from the National Health Insurance Scheme itself. So in other words, all those that participate are required to then see the public free of charge. Then the other issue is registration of individuals. So every single Zambian should be registered on the system. There's an online system at the moment which NIMA is facilitating, where you register and you're given a particular number, and that number is meant to give you access to healthcare services should you go to any of those healthcare providers that are already accredited. So that's the main approach. So one, they first accredit the different institutions, and then two, there's also a member registration where each individual has to have a particular number and for them to access the services. So what we have at the moment is that basically all of those that are accredited healthcare providers are public institutions and also faith-based institutions. So what we're not seeing are a number of private hospitals participating in the scheme. That's problematic.
Yeah. All right. You are saying that's problematic?
Yes, it is, in the sense that what it means is that you still have inequalities in terms of your access to healthcare. Because I'm a member of NHIS, which I am, by the way, as a law-abiding citizen. I do remit my 2% to the NHIS.
Yeah.
I should have an option as to where to go for my healthcare services. If I want to go to UTH, that should be an option to me. If I want to go to Fairview, it should be an option to me. At the moment, places like Fairview or CFB and the likes, sorry to mention names, but they aren't participating solely in this scheme. Whether it's an issue of NIMA itself trying to get them on board, or whether it's because as a private institution they want to reserve the right to charge and make a profit. That's within their rights as well. But what we need to then see is coordination between private institutions and public institutions, so that you bridge the inequalities, because it means that if all I have is the NHIS, then the only places I can go to are the public hospitals. And they may not necessarily have all that I need in terms of the services and the care that I require.
All right, and how does one become a member? You've proudly said that you're a member of the insurance scheme, but how does one become a member, and what efforts are being done to ensure that quite a majority number of citizens are covered in that particular scheme?
Yeah. So the National Health Insurance Management Authority, which is NEMA, they actually have a website that they have on which you can register for your membership to the National Health Insurance Scheme. And I know that they are also engaging, to some extent, employers to register, have their employees registered on the National Health Insurance Scheme. So I think that they have been robust in terms of putting themselves out there, but it's been mainly an online interaction, which is why we're saying it also creates a challenge, because to what extent then are you engaging those communities that have less access to digital services, like in the villages or the rural areas where they don't have internet access? They may need to look at it, perhaps looking at a manual system of rolling out this system for the time being.
All right. So, and how does one become eligible to be able to be part of this particular scheme?
Well, by law, if you are between the ages of 18 and 65, then you are required to be remitting your 2%. It's compulsory. It's not optional. So, legally speaking, every Zambian should be a member of the NHIS.
All right. Let's dive into if there will be any exemptions from contributing towards the insurance, national health insurance scheme. Who will be exempted from contributing towards the scheme?
Yeah, so there are exemptions in terms of those who are physically challenged, and also those who are above the ages of 65, and of course those who are below 18 also be exempted. And then there is a provision for those who may not be able to afford the remission of the funds for various reasons. So there's provision as well for those to apply for an exemption.
All right, and what happens to like you did mention that there are some loopholes and lacunas in trying to get the people in the rural areas to be able to be part of the scheme. What suggestions would you give in trying to ensure that even the people in the rural areas, in the outskirts, contribute towards the scheme in this particular aspect?
Okay, so I think first of all there needs to be a mass rollout of National Health Insurance Scheme, and that may require even potentially, as I said, physically visiting these different areas that are far flung and hard to reach, to try and have sort of a mass enrollment program, even in the informal sector. Whether that is practical at this point in time it remains to be seen. We have a COVID-19 third wave at the moment. The numbers are incredibly high, but we have to explore options such as that, so that there's a mass sort of enrollment onto the program. Yeah. And in so doing, then also being able to account to say who is remitting and who is not remitting. Obviously, each person remits to the measure of what they can afford. So it's inevitable that those who have more will be subsidizing those who have less. But what we don't want, and what we currently see, is a situation where the majority of those who are actually financing the NHIS are those who are in the informal employment. And that's a very small percentage of the population. Yeah. And so in terms of also just raising adequate financing, it's not very feasible. So we would want to see, obviously, at some point, some sort of initiative by the NHIS, or by NEMA rather, to sort of have a mass enrollment of citizens across the board into the National Health Insurance Scheme.
All right.
That's one thing.
Yes.
And then secondly, also, we have to look at investing in basic infrastructure. As I mentioned before, at the lowest spectrum of the of society, there are individuals who have to travel hundreds of kilometers to access the nearest healthcare facilities, and there are very few doctors per community setup. So at some point, we have to look at also investing into basic infrastructure. We have to look at how the NHIS or the NEMA can actually look into building clinics and basic healthcare facilities as well, so that you also then minimize the burden on those that are currently existing.
And what of course, realizing that we are in the COVID era, and people would want to obviously get hold of the benefits or the advantages of this particular scheme, especially looking at it that we're being faced with a pandemic, which is a health risk, and people are wondering what could be the benefits of the National Health Insurance Scheme.
Well, the main benefits, what it's supposed to do is provide you access to healthcare, free access. So if you're a member of NHIS, you're supposed to be able to access your a healthcare provider and not experience too much out-of-pocket expenses. So in a COVID-19 era, where we know that, first of all, COVID treatment is very expensive. We don't have the facilities at the moment in terms of whether it's bed space or oxygen because of how high the numbers are. A scheme like this should be stepping in to alleviate some of that financial cost and burden onto the citizens. What we don't want to see is citizens being turned away or citizens not being able to access their health care because they have not enough money, but because they can't afford the out-of-pocket expenses. So it is supposed to provide us all with access and also provide us with a particular healthcare package. If you look at the NEMA website, there actually is what is known as a benefits package. So it's a package which highlights, or which stipulates rather, the basic services that NEMA is meant to provide, or that specific, or that the different health providers should be able to give you. And part of that, of course, is COVID treatment. And so in the absence of the NHIS being able to do this, it means that basically many of us are being shortchanged. So that's the role which the NHIS is supposed to be playing at the moment in this COVID era.
All right, and what gaps has it come to break in terms of trying to access this particular health scheme? Because I know COVID-19 has brought in quite a lot of challenges and quite a lot of loopholes here and there. What has COVID-19? How has this particular pandemic affected the contribution towards the National Health Insurance Scheme?
I mean, to be fair, I think that COVID has shown us that even the most advanced systems have loopholes in their healthcare systems, and Zambia is no different. Especially that we're at the bottom end of the spectrum in terms of our resources as a country. But we definitely have limited resources, and what COVID has done is to definitely highlight those inefficiencies. But in terms of remitting, I think that all those who are still in formal employment at the very least are still remitting what they're required to remit in terms of their finances. So, of course, there have been layoffs and so forth because of the COVID-19 pandemic. A lot of companies have had to slow down or shut down. That has affected, of course, I'm sure, the inflow of revenue for NEMA. That goes without saying. But again, it speaks to my earlier point as saying why we need to have a wider coverage in terms of, or rather wider participation in the NHIS and wider enrollment or mass enrollment of citizens, both formal and informal sectors.
All right. We'll be able to receive some calls. We'll be able to open the phone lines now. We'll open the phone lines now and, of course, receive some calls and obviously get some questions from the people who are watching live from the different places that they are. The number that you're calling on is 0764 250055 0764 250055. That is the number that you're calling. Call us, and if you have any question with regards to the National Health Insurance Scheme, do come through. And of course, as well, pounding on the issue of this particular scheme in the COVID era. Call us on the number that is showing on the screen, and let's get your questions and your contributions toward the topic at hand. 0764 250055 0764 250055. That is the number. Call us and let's definitely discuss. Now, Ms. Mange, I don't know for a fact that healthcare providers who want to join this particular scheme will be let to join, but how do they join the scheme?
So what we do know is that NEMA itself has a system where it accredits the different healthcare providers. What that process entails, I'm not privy to, but they do go through a process where they assess the different healthcare providers, the different hospitals, pharmacies, and laboratories for participation, for them to qualify to participate in the National Health Insurance Scheme.
So they'll need to go through accreditation for them to be part of the scheme?
That is correct. They have to qualify, yes, that's correct.
All right. Okay, all right. Now, how will this then, accredited healthcare provider ensure that there is quality?
Well, that's something again between the healthcare providers and NEMA in terms of what their specific. Each healthcare provider obviously has to meet certain criteria and has to be able to provide a particular basic minimum package for them to be accredited in the first place. And so what we have seen, interesting enough, is that almost all public institutions countrywide are a part of the National Health Insurance Scheme. What we're not seeing are the private institutions, as I've mentioned. And as I said earlier, this presents inequalities because it is often the case that the private institutions have way more infrastructure and better facilities than the public institutions would have. But at a very minimum, what they should provide is basic access, primary health care, a bed space, and so forth, at a very minimum. If you're looking at a hospital, for instance, if it's a pharmacy, they have to meet certain criteria as well in terms of what drugs they've got available, and so forth and so forth.
All right, and how will the accredited providers benefit? What benefit will they definitely get from all this?
Okay, so the way it's supposed to work is that NEMA is then meant to remit to the healthcare providers whatever out-of-pocket expenses the individual should have spent. So, in other words, if you fall sick, you go to a particular hospital, you get the healthcare for free and services for free, and then NEMA is then supposed to reimburse those institutions whatever expenses they've incurred in treating you. And this is based on the fact that you've been remitting to NEMA or the National Health Insurance Scheme for the last God knows how many months.
All right. Will the services be provided in the rural areas as well? I don't know for a fact that
universal healthcare implies.
Yeah.
So it implies that yes, everybody should access the universal healthcare, even the rural areas. And what we do know is that many of the rural areas are serviced by faith-based organizations. A good number of which are also part of the NEMA and are participating. So yes, it's supposed to be nationwide, universal.
And do we see this, pragmatically happening in the rural areas? Is this already, being ensured in the rural areas?
Well, I cannot speak to how efficient the implementation has been in the rural areas because I have not been there. I have not seen it. But looking at just how the rollout has been done in terms of registering online and so forth, it's not very. I'm a bit skeptical as to exactly how efficient they've been doing so in the rural areas. But the fact is, the services, the healthcare access should be available also there in the rural areas.
All right, great. Definitely, people watching, you are able to call us on the number that is showing on the screen, 076525 0764250055. That is a number that you are calling us on. Be able to call us and definitely contribute or ask any question that you do have for our guest this particular evening. She's coming from Center for Trade Policy and Development. We're discussing the role of the National Health Insurance Scheme in this COVID era. The number is 0764 250055. 0764 250055. Now, Ms. Mange, of course, I do know for a fact that this particular health insurance scheme was fostered to ensure that there is universal health coverage across all areas in Zambia. And I do know for a fact that Zambia is one of the countries that have signed towards the Sustainable Development Goals. And this is under the goal number 3 of well-being and good health. How would you assess the aspect of this particular scheme in trying to foster good health and well-being in all parts of the world?
As I mentioned earlier, the initiative itself is a very good idea. I mean, just ideologically and in principle, the idea of having universal health care or free healthcare for every Zambian is one that I think speaks to any sort of like developmental index. I think we have to appreciate as well, though, that it is a huge administrative conundrum. A lot of paperwork has to go into this, a lot of management has to go into implementing a system such as this. And as I said, even in advanced countries where we have seen, where we thought that they were far ahead of us, we have seen them also show loopholes through the COVID-19 pandemic, where people were being turned away in your most advanced countries. So we know that it's baby steps and that there's a lot of work that needs to be done. But that shouldn't stop us from identifying the bottlenecks as they exist right now. So for instance, as I said earlier, we have high unemployment rates in Zambia and a very small formal sector working force. And what we have is basically that small workforce currently bearing most of the burden for financing of the healthcare system in Zambia. So we need to have mass work. We need to also basically look at the context that we are in, understand that because we have a huge informal sector, how do we then enroll that population into the National Health Insurance Scheme so that there's at least better equality spread across and not overburdening a small portion of your society.
Oh yeah, and do you see ourselves as Zambia being able to ensure that the good efforts towards SDG number 3 of good health and well-being? Well, this question is coming from the aspect that we only have about 9 years now, for the SDGs to completely get done with. And of course, these goals have been there for some time, and others are calling this particular remaining year from now to 2030 that it is the decade of action. And of course, we do know that this health insurance scheme is one of the actions that foster the good health and well-being. But how would you assess really the achievement of Zambia in ensuring that we have goal number 3 of good wealth and well-being rather, and by 2030?
Yeah. So in terms of action, I think that implementing this national health insurance scheme is a good action. Yeah. I think it puts us in the running to at least achieve some level of success by 2030. As I'm saying, it's been 2 years since the implementation of the NHIS, and there will obviously be a lot of teething problems, and we have to address many bottlenecks. But it's important that we address them early on so that we can actually meet these goals, or rather make the goal to achieve certain milestones for 2030 more achievable or more realistic, shall I say. So I think in terms of putting ourselves out there, we've done very well, and there aren't very many countries on the continent who actually have this sort of system in place yet. So we've done well to do so, but we need to then, of course, address these bottlenecks, like I'm saying. So, I mean, we have recommendations like, for instance, investing in basic infrastructure. Yeah. We need more human resources. We need to have a more effective health information system. We need to see how we can ensure there's mass participation and enrollment of those even in the poorest and most accessible areas. We have to look at developing coordination between the private and public sector so that there's more participation by the private sector in the National Health Insurance Scheme to ensure that there's also been quality healthcare across the board, so that if you are in Shangombo and you are in Lusaka, you have opportunity to access similar kind of healthcare services. So we have to be able to address all of these bottlenecks early on in order for us to have realistic, in order for us rather to attain any sort of realistic achievability, if that's even a word.
All right, and of course, I do know for a fact that the 7th National Development Plan is, one of the policies that looks at leaving no one behind. But of course, you have outlined the aspect of the rural areas where there is need for much more work in terms of trying to get everyone on board in the scheme. But let me ask it in this particular way. In the aspect of in the aspect of the rural areas especially, are we going to see that everyone in the rural areas are benefiting from this particular scheme and contributing towards the scheme with the pace that we're going in this particular COVID times? We do know that there's less movements, there's less ensuring of there is need for masking up and social distancing. How then do we ensure that in these COVID times we're reaching towards even the people who are in the rural areas?
So, I mean, theoretically, that is the goal. Theoretically, the goal is that every Zambian should have access. So even those in the rural areas should have access to this to healthcare. That is the goal on paper. That is theoretically what it's meant to be.
All right. Let me just hold you there. Let me just hold you there. We do have a caller. Hello. Good evening.
Hello. Good evening.
Yes. Your name and where you calling from?
Okay, I'm calling from Kitwe. My name is Chanda.
All right, Chanda from Kitwe. Yes, please give us your question.
Okay, I'm following you on Movie TV.
Yes.
On the insurance. I'm in employment. And I would like to get insurance for my mother. How do I go about it?
Okay, all right.
Okay.
All right, just get tuned in. We'll definitely let our guest answer that one.
All right, thank you so much.
All right, thank you, Chanda from Kitwe. All right, the number is 0764250055, 0764250055. If you have any question or contribution towards the discussion at hand, the role of the National Health Insurance Scheme in this COVID era, please do come through and call us. All right, so you can finish that question, and then I'll be able to repeat the question that Chanda from Kitwe has for us this particular evening.
Okay. So I was saying that theoretically everyone should be able to access the National Health Insurance Scheme and access to all the services that they need, even in the rural areas. We do have a challenge, as I've said, in terms of how it's being handled in terms of the registration of members. And so far it seems to be an online system. And because we know that there is limited access to digital services in the rural areas and internet services in the rural areas, what does that then mean for the registration of those members? So that, yes, that may require an element of physical enrollment from what we have assessed as CTPD. But I do understand that being that this is a COVID period, it may not be very feasible at this point in time. But this system is here to stay. NHIS is here to stay. It's not a short-term solution. It's a long-term solution. So we have to look at some point, once the curve is flattened, how then can the NHI, or how then can NEMA itself look for innovative ways of reaching the rural areas? And I think as CSO and as different stakeholders, there is room for coordination and sort of a multi-sector approach to deal with this situation. We appreciate the fact that it's still very early days in implementation, but we are seeing these issues now, identify them now, and deal with them now so that we can actually achieve the success going forward.
Yeah, I really wanted you to re-echo and definitely explain further on that particular aspect, because there may be a lot of people watching us and millions of Zambians wondering how even they're going to be catered for, realizing that certain policies are there put in place to leave no one behind, and some do feel left behind with regards to the process. But let's get to Chanda from Kitwe's question. She's in employment, and she's in employment rather, and she wants to get the National Health Insurance Scheme for her mother. How does she do that?
Okay. So assuming her mother is above 65, or perhaps she may have some sort of disability, she qualifies to be on the National Health Insurance Scheme. NEMA actually has a website. It's a fairly user-friendly website, and even a toll-free line that you can call to get the process starting. So that's what we do know, that there is the website and also a toll-free line that you can use to then start the process rolling. And your mother would then, or anyone above 65, so the pensioners and so forth, they're eligible and aren't required to remit the 2% that the rest of us are remitting. The principle being that those of us who are still working and so forth will cater for those who are now pensioners. I think that they've done enough service to the country to deserve that much at least.
All right. Now, of course, she might be wondering where does she access this particular website, or what is the toll-free number? Because she did clarify that she would want to do it for the mother. But where does she access this particular website and the number that she can call on?
So I don't have the number off the cuff, but if you go to nima.co.zm, you should be able to find all that information.
Nima what? Just mention it again.
nima.co.zm. So Nima as in NHIMA.
All right. I'm sure she's
.co.zm.
Okay. All right, great. If you have any questions for our guest, Ms. Chileshe G. Mange from Center for Trade Policy and Development, do come through on the number that is showing on the screen, 0764 250055. Call us and be able to ask her anything related to the National Health Insurance Scheme, and of course, and how we can manage it in this particular COVID era. All right. Of course, we still continue to dig deep on this particular topic, Ms. Mange. Of course, I do know for a fact that this particular health insurance scheme, you did mention that the healthcare providers will indeed be able to be able to contribute towards this particular scheme, and you've also mentioned on the aspect of trying to ensure that there's quality for this. What is the role of the private sector in trying to ensure that this particular scheme is reached to its objective?
I think as the private sector, because they have access to more resources, and in the context of health, better infrastructure and better facilities across the board because of the aspect of making a profit, I think that they have to get involved, or they should get involved, to create some level of uniformity. And that, of course, is the onus to do that, of course, lies on NEMA and they themselves to coordinate and come up with a system where, at the very least, even those that wouldn't normally be able to afford private facilities, as of right now, issues like MRIs and other diagnostic facilities, that should be available to them, which will that NEMA can facilitate. So the private sector has to get involved to a large extent for this to even work efficiently, and for us to have uniformity and address the inequalities. That's the role that they should play as the private sector.
All right. I do know for a fact that someone was trying to call us. Please do call us back on the same number that is shown on the screen, 0764 250055, 0764 250055. Call us, and of course, we'll be able to answer your questions with our guest, Ms. Chileshe G. Mange from CTPD. Now, of course, let's break down the guiding principles of the National Health Insurance Scheme.
So there are two main principles really, is to work three, I think. So financing, so raising money towards healthcare. Two, universal healthcare. In other words, providing every Zambian access to healthcare. And then three, providing health coverage. So meaning that every Zambian should have access to specific services. Those are the three main, I think, guiding principles of the National Health Insurance Scheme. Or shall I say the three main pillars, as it appears to be based on how the law has been drafted.
And of course, you did mention that these contributions, of course, towards the scheme will be for those who are eligible, or are able rather to pay for the schemes, isn't it? 2%, is it, you mentioned?
Yes. So what the law provides for is that 1% is paid for directly by the employee, 1% by an employer, and this applies to both formal and the informal sector. So in total, you're supposed to remit about 2% of your earnings towards the National Health Insurance Scheme, as every Zambian citizen and resident, as it stands.
And for those who cannot be able to pay, realizing it is a poor particular scheme, they'll be able to have it for free, is it?
That's correct. So those who, either due to age or some sort of physical incapacity, are unable to earn a living, and therefore cannot remit, those will still be able to access the National Health Insurance Scheme free of charge.
Yeah, and how what accreditation is given, or what guiding, objectives are given per se to scrutinize a person who is eligible to pay or not.
So what the law provides for is those, like I've mentioned, those who are above 65 or below 18 are exempt automatically, and then those who may have some sort of physical or mental incapacity. And then there is also a provision for those who maybe due to circumstances cannot afford, and then those then have to then apply for exemption.
Oh yeah,
so it's basically age or incapacity.
Yeah, so what I meant is, okay, maybe let me ask it in this way. What I meant is it mandatory or it is voluntarily for a particular person to pay? And that was the guiding objective I was asking. Is it mandatory that each particular person who is eligible to pay for it should pay?
Yes, it's mandatory. So it's a legal requirement. There's no running away from it. Every Zambian. So if we talk about universal health, universal health care, and universal health coverage, every single Zambian should participate. And the way the law is crafted, the NHI Act, every single Zambian is required to participate. It's mandatory. It's not a voluntary system, so you can't opt out of this one. Which is why I was saying one of the issues that has to be addressed then is the fact that while everyone is required to participate in the NHIS, we still have a parallel system with other insurance providers, where private insurance providers, in other words, where it's the case that some individuals are paying NHIS and also then paying a private insurance provider as well. And so that also then creates an expense and a burden to individuals. So there has to be a harmonization between the public insurance provider, which is the National Health Insurance Scheme, and those that are providing private insurance. There has to be some sort of harmonization between the two for it to be truly effective.
Oh yeah. All right. Yes, indeed. The number is 0764 250055, 0764 250055. That is a number that you are calling us on, that is showing on the screen at the moment. And of course, as we wind up, Ms. Chideshe Jimange, of course, what are your final remarks with regards to the role of the National Health Insurance Scheme in this COVID era?
So, in a nutshell, I think that we understand. While we understand that the NHIS is still pretty much in its infancy stages, it's expected that at this point it would be stepping in, or INIMA would be stepping in to alleviate some of the burden that has been experienced in the COVID era. So whether it's procurement of medication, procurement of vaccines, procurement of essential life-saving equipment, whether it's oxygen and so forth, whether it's stepping in to facilitate diagnostics for individuals who are members, or whether it's ensuring that every single individual who requires the healthcare is able to access it. Those are the kind of things that we expect to see from the NHIS, even those in the infancy stages. So, I mean, if ever there was a time when universal health care or universal access should be fundamental, it's at a time like this. And so I think what we're calling on as CTPD is for NIMA to, I guess, to some extent, address the bottlenecks that we have highlighted, look into how exactly these, how to have mass participation and mass enrollment to raise more revenue, and in so doing then prioritize particular issues such as infrastructure, prioritize having a proper management information system, prioritize having the capacity administratively to manage the different cases as and when they arise. We would like to see better coordination with the private sector to ensure that inequalities in healthcare services are also addressed. And then in closing, I do want to say that as CTPD, we're not here speaking for NHIS or speaking against it. What we have done is to analyze the situation on the ground as we have seen it, looking at, first of all, what the law provides, looking at what we have seen in terms of who has already been accredited, what progress has been made, and also then just evidence on the ground in terms of how this has been rolled out. And so what we're here to do, what we've done here today is try to highlight to the public and even to NHIS itself what we think should be addressed for a more effective healthcare system, especially given the situation right now with COVID-19 pandemic.
All right. No, Ms. Chileshe Mange, thank you so much for coming through on Unscripted to discuss and help us, of course, cultivate the role of the National Health Insurance Scheme in this COVID era.
It was my pleasure. Thank you for having me.
All right. Yes, indeed. Unscripted is what you were watching on the 9th of July 2021. Of course, we'll be back next week at the same time with the Center for Trade Policy and Development. My name is Chisha Chola. Thank you so much for watching. Coming up next is the news at 21:15.
Tisebenze pamoja ya mai, matenda tingasilize. Tisebenze pamoja ya bambo, kamozi tingakwanise. Tisebenze pamoja ya mai, matenda tingasilize. Tisebenze pamoja ya bambo, kamozi tingakwanise. As we adapt to the new normal, together we can kulio and a solo. The farmers and the traders must sell like a
tientisambe kumanja osagwila kumenso makamaka mwe balimi mwali ba essential
mulyesha ziko
chachina
ole mekezedwa
mukalale plasi konsefe na kumishi amafunde balesosa tuyasungishe
tigwirizane tinkale panja imbozi ikorona sinapwele kuchita vingazi ikorona ilibendiwe fama ikorona ilibe ikorona ilibendine lida anza kontolola no korona ilibendine teacher korona ilibendine doctor korona ilibendine polisi anza kontolola
tisebenze pamoja ya mai matenda tingasilize tisebenze pamoja ya bambo kamozi tingakwanise tisebenze pamoja ya mai matenda tingasilize tisebenze pamoja ya bambo kamozi tingakwanise
lile mule afu abalimi mwe balabako kwabula bena nefya kulyanga tafibako tientu konkanya pofe kula isunga namafunde basosokula ya konka COVID-19 kutwa ichimfe tubike pofe ka hygiene
uko kufamu valani na mamaski kuzamba kumanja ndiye gani